Hello and welcome. My name is Johnson Simon. I'm a registered nurse and a medical student. So today we'll be going over a few questions, past questions from the Nursing and Midwifery Council of Nigeria, which is essentially suited for general nurses, university student nurses, and basic midwifery students. So if you are about to write your nursing council exams or maybe hospital final or rather a mock examination, then this video is for you. So we're going over 100 questions and I'll be basically explaining why an option is correct or incorrect. So the video will be especially long, so please let's get started. So let's start with the first question. It says the hallmark of primary health care, without which primary health care will not succeed, is. So take a good look at the options. But before then, I want you to understand what it means by the hallmark of primary care. It's essentially basically asking you to identify a characteristic feature of primary health care without which it cannot proceed or succeed. So if you look at the options clearly, you see that all of them seem similar or could be the answer, but B is actually the answer: community participation, and I'll tell you why in a moment. So we know that community participation is the central principle of primary care, right? It emphasizes that health services are most effective when the community is actively involved in planning and implementing health programs, ensuring that the services meet their specific needs and are sustainable. Now, why is A, C, and D not the correct answer? So you see, community mobilization is the process of getting people to act, which is actually part of participation, but it's not an overarching principle. For self-reliance, it is a goal of primary health care, but it is achieved through community participation and not a defining feature itself. So community motivation is just an internal drive to participate, which is a component of participation, but that's not the answer. It's not the entire concept. So let's go to the second question. It says the following are attributes of TBAs or traditional birth attendants except. So what is actually saying that all the characteristics here from A to D, they are all characteristics of TBAs, but one of them is not. So if you take a good look at the options, please take a good look with me. A, B, C, D. Which of them do you think is not an attribute or a characteristic of TBA? A is the answer. Okay, I'll tell you in a moment why. Let's check out why A is the answer. It says that there are midwives who have limited training to acquire the skill of taking delivery of a baby and are licensed to operate in a maternity home. All right, we know A is not the answer, and as I said, you see, a TBA is not a licensed midwife. That's what you should understand. And they don't operate a formal maternity home. They don't have any formal training. So they are usually committee members with traditional knowledge who assist in childbirth. Their role as per the other options are not correct or accurate. So let's go to the other question. The third question, it says, the following are used in carrying out community diagnosis except. So what it's saying is that all the options could be potential answers except one. So let's look at the option that cannot be used in carrying out community diagnosis. It says direct physical observation that is on the spot assessment. Yes, you can use direct physical observation to carry out to carry out community diagnosis. What about B, obtaining records from the health centers? Yes. Obtaining information by the use of questionnaires? Yes, of course. If you've carried out your project research, you know that questionnaire is very essential. All right. What about the use of advanced computer technology to obtain information? No, this cannot be the answer. So this will take D as an answer, and I'll tell you why. The reason why D cannot be the answer is because you see, computers are basically used to analyze collected data, all right, but they are not the basic method of obtaining the information itself. So that's why it is the correct answer here, all right, in respect to this. That means A, B, and C are all similar, but this seems to be the odd one out. So as for the next question, it says one of the following statements is not true of the rationale and role of community mobilization. What's the meaning of rationale? Rationale means reason. So one of the following is not true of the reasons and the role of community mobilization. So take a good look at the options A to D and then you tell me your own answer. So what do you think the answer is? If you take a good look, you realize that B seems not to be the answer here. All right, so it says that it makes the government to shy away from their total commitments and responsibilities, thereby conserving their financial expenditure. All right. So the reason why it is the correct answer is because the statement entirely is false. Okay. The purpose of community mobilization is to empower the community to identify and take action on their health issues in partnership with the government. It is not to relieve the government of its duties and financial communities and commitments. Okay. So why is A wrong answer? Why is C and D wrong answers? Because for A, we know that community mobilization encourages community to identify their own health problems. For C, we know that it enables communities to address their problems using available resources. And for D, we know that it fosters self-reliance and confidence within the community. So that's it. Let's go to the next question. So according to the World Health Organization guideline on the quality of a safe potable drinking water, water is considered unsafe if the presence of coliform/pyrogen is greater than what? Is this 5 per 100 mils, 10 per 100 mils, C or D? Okay, as for here, the answer is B, and I'll tell you why. So the answer is actually B because it's important to note that for a standard safe drinking water supply, the ideal is actually 0 coliforms per 100 ml. However, for a threshold of unsafety, 10 per 100 ml is the specified answer in this particular context. So the other options are wrong. The next question, the act of taking a life to relieve suffering is known as what? Now, please take a good look at this answer. You may know the answer, but you may miss it because if you notice A to D, the options seem similar. Actually, they only define their spelling. So which is the correct answer here? The correct answer is actually C. Okay, euthanasia. So what's the meaning of euthanasia? Euthanasia is just a medical and ethical term for intentionally ending a person's life to relieve pain and suffering. All right, so let's go to the next one, nosocomial infection. I think you answered this yourself, so let's see your prowess. So nosocomial or hospital-acquired infection are those that occur when. Now take a good look at the options. If you notice the options seem similar, all right, and if you don't have a deep knowledge of what nosocomial infection is, you might fail this question. All right. So what do you think the answer is? So the actual answer is A. The incubation period and the manifestation of the disease is shorter than the period of the patient's hospitalization. And I'll give you an explanation to why this is the correct answer and the rest are incorrect. All right. So the reason why this is correct actually is this. Nosocomial infection are actually those contracted by a patient while in the hospital. We all agree with that, right? So now this implies that the infection's incubation period is shorter than the patient's hospital stay. So the symptoms manifest while the patient is still admitted. All right. So now we know that the other options are actually wrong because they either portray an incorrect definition or the time frame for the hospital acquired infection is wrong. Okay, so A is the answer. Well, let's just take a look at B. It says the incubation period and the manifestation of the disease is longer than the period of the patient hospitalization. No, it's shorter. It says the incubation period and the manifestation of the disease are the same. Nope, they can't be the same. They have to be different. The incubation period and the manifestation of the disease are immediately. This option doesn't even seem to reason well. So let's go to the next question. It says need for food, air, and elimination, rest, etc. are classified under which of the following Abraham Maslow hierarchy of need? So what do you think this should be the answer? This is a very simple question. I don't think we should spend time here. These are actually physiological needs. Physiological needs are actually the most basic and fundamental needs, okay? And we know that food is fundamental and basic, air is fundamental and basic. So safety, no, love and belonging, self-actualization, no, these are not the answer. Physiological needs is the answer. So let's go to the next question. It says, hindrances to the successful eradication of poliomyelitis in Nigeria could be attributed to the following factors, except. So what it's actually saying is that all the factors can contribute to the eradication of polio in Nigeria, but only one of them is not the answer. So what do you think the answer should be here? All right, so let's take a good look. It says belief and taboos. Yes, we know that beliefs and taboos could be factors, okay, that could hinder eradication of polio in Nigeria. For example, you know that some people believe that vaccination could, promote infertility and stuff like that, so that could hinder the eradication. All right, especially it's very common in the north, or it has been common in the north. So inaccurate dosage of a vaccine given, yes, if you give under dosage of a vaccine, of course it will hinder the eradication, right? What about the shortage of funds? Yes, of course, shortage of funds. If there are no funds, if the logistics is improper, we know that immunization program will not be successful. What about the maintenance of a cold chain system? This is the answer. Here we have the answer. Now, I know that for some students, they won't even understand what maintenance of cold chain system is, and I'll explain it in a while. All right, so a cold chain system is essential for keeping vaccines viable. All right, therefore it is a facilitating factor and not a hindrance. It's just like, ensuring that the vaccines are maintained in a cold temperature, okay, the required cold temperature, which could actually differ from different vaccines. So that's the answer. So the next question, it says, the first modern pharmacological compound was made by who? All right, we know. Okay, let's do some elimination. All right, so is it A? You might not be sure it's A. What about Hippocrates? No, it can't be Hippocrates. What about Florence Nightingale, the lady with the lamp? It can't be her. What about Edward Jenner? Now, for some people, I know they might be thinking, is it A or D? Okay, actually, the answer here is Frederick Waller. All right, and I'll tell you why this man is a person. So we know that Frederick Waller is actually known for his work in synthesizing urea, which was a significant step in the history of organic chemistry and pharmacology. So if you know your pharmacology very well, you should know that A should be the answer. All right, Edward Jenner, I don't think it can be Edward Jenner. I think Edward Jenner was associated with, what was it? What was he associated with? Is it founding of vaccines or something like that? But I know it can't be Edward Jenner. It should be A. All right. So let's go to the next question. It said that the combination of a drug that interacts with another to produce increased activity, which is greater than the sum of the two drugs given separately, is called what? Synergism, summation, addition, combined therapy. If you know the definitions of each, you know that A is the right answer. So what is synergism in the first place? We know synergism is actually a term for a drug interaction where the combined effects of the two drugs is greater than the sum of their individual effects. All right, so this is the answer. I don't think we need to even explain why the other ones are wrong. If you just know the definition of synergism, you know that it's actually the same with what the question is asking. So for number 12, it says the capacity of a drug to produce the maximum desirable effect is referred to as what? Come on, guys, you should know this. Drug efficacy. Simple and short. I don't think we need to know why B, C, and D are wrong. A is just the answer. Okay, so there are some questions that you don't even need to know why the rest are wrong. You just know that this is the answer. Okay, and for these 11 and 12, we know the answers. Okay, number 13, an unusual exaggerated reaction to a drug is called what? This is where I know some people will surely fail. All right, okay, let me give you the time to answer it yourself. What do you think the answer is? Is it A, B, C, or D? All right, some people will have answered it correctly. So the answer, without wasting much time, is idiosyncrasy. What is idiosyncrasy? All right, so idiosyncrasy is just a very rare reaction. It is a rare reaction, number one. Number two, it is unpredictable. And number three, is an exaggerated response to a drug that is not an allergic reaction. Okay, exaggerated response to a drug that is not an allergic reaction. So D is the answer. All right, D is the answer. The rest are wrong. Please, this is the answer. So number 14, a condition with repeated administration of a drug harmful to the individual and sometimes to the society is called what? Drug repetition, dependence, reliance, or hazard. What is the answer to number 14? Answer to number 14 is drug dependence. I'll tell you why. Okay, so we know that drug dependence actually describes a state where an individual needs to repeatedly take a drug to function, which can be harmful to both the individual and even the society at large. For example, if you do you know what drug withdrawal is like? For some people, they are very addicted to some certain drugs, okay? And when they try to stay away from the drug, they develop some symptoms, okay? This could be so related to drug dependence. They are so dependent on the drug that if they don't take it, in fact, hell could reign. So that's what it actually means. A condition associated with repeated administration of a harmful drug to the individual. All right. Some of the drugs include pentazocine. Penta. Wow. There are some people that are so much depend on penta that if they stay away from it, drug withdrawal symptoms could just lose on them. All right. So let's go to the next question, number 15. It says, when dairy products like milk are taken with antibiotic like tetracycline, what happens? A, B, C, D. What do you think is the answer? Number 15. Can anyone give me the answer? I'm waiting. So, as you have all said, the answer actually is A. Okay, there's decreased absorption of the drug in the stomach. Okay, I know some people might know the answer to this, and I'll explain it in a moment. So, we know that we have calcium in dairy products, right? And so normally when you take them, the calcium will bind to tetracycline. If you take tetracycline, calcium in the dairy products or milk or furanono will bind to tetracycline, which will form a non-absorbable complex that prevents the antibiotic from being absorbed into the bloodstream, making it less effective. So that's it. The other options are actually wrong. So there will be decreased absorption when you take dairy products with antibiotics like tetracycline. So don't mix them. So number 16. In a client with alcoholism, the primary rehabilitator is who? Is it the nurse, healthcare system, family, or physician? This question could be very, very tempting and confusing for most people. You see, there are some questions, okay, MCQs that will seem simple, but sometimes you just fail. All right. And you begin to wonder why you failed. So the answer here is the family. It is not the nurse. Just because you are a nurse doesn't mean that the nurse should be the primary rehabilitator. It's the family. Okay, let's take a scenario. Let me ask you some questions. Who brought this family member to the hospital? It's not the family. Okay. When the client or the patient goes home, who takes care of that client at home? It's not the family. So therefore, the family is actually the primary rehabilitator. Okay. All right. So number 17. The criteria for providing the causal relationship between a microorganism and a specific disease is known as what? Let's read this question again. The criteria for providing the causal relationship between a microorganism and a specific disease is known as... Let's see. If I've read my book very well, C should be the answer. Koch postulate. C is the answer. And please, as a note, if you think any of my answers are wrong, you can tell me in the comment section, but I'm very sure all of them are correct. Okay, so why is C the correct answer? We know that Robert Koch, which is the person's name, postulates that there are a set of 4 criteria which are developed to establish a causative link between a specific microbe and a specific disease. So the other options are not even related to the concept at all. Pasteur's postulate, Jenner's postulate, they are not related to the concept, but Koch postulates actually relates to the question asked. Okay, so number 18. The ability of the body cells to engulf foreign material such as microorganisms is called what? All right, if you've read cell physiology very well, you know that the answer is phagocytosis. 18 is C, phagocytosis, the process by which cells engulf solid particles such as bacteria, dead cells as part of the immune response. All right. So A, B, and D are not the answer. Please don't get confused. That's why it's good for you to read. All right, so you don't get confused on very simple questions like this. Let's go to number 19. The first direct demonstration of the role of bacteria in causing disease came from the study of anthrax by who? Number 19. Who do you think is the person? Louis Pasteur. Louis Pasteur is the person. No need to think much about this. So why is Louis Pasteur the answer? We know that Robert Koch is actually credited with proving the link between anthrax and a specific bacterium, right? Louis Pasteur work is actually on the germ theory and fermentation, and it provides a foundational step in understanding that microbes could cause disease. So the other options are actually not credited with this specific discovery. All right. So number 20, it says oxytetracycline and chlorotetracycline are naturally produced by that species of microorganisms. All right. So let's crack our brain together. Number 20, what do you think is the correct answer? Let's see. Actinomyces, Clostridium, Bacillus, Pseudomonas. A is the answer, I'm very sure, and I'll give you an explanation to that. So, why do you think it's even correct? So we know that oxytetracycline and chlorotetracycline are antibiotics which are derived from the Streptomyces genus, which belongs to family Actinomycota. So you see, Actinomyces is the answer, because this oxytetracycline and the chlorotetracycline, they are actually derived from A. So that solves it. So you need to know your microbiology very well. So let's go to the next one. It says the process of inhibiting the growth and multiplication of microorganisms is called what? I don't want to spend time here. It's bacteriostatic. Where is it? A is the answer. Bacteriostatic. Do you need to know why A is the answer? Well, bacteriostatic is actually a substance that inhibits bacterial growth, okay, and reproduction. So that's why it is. We know that phagocytosis, of course, I told you what phagocytosis means, right? Engulfing of bacteria and their substances of cells. We know what bactericidal is. It's just like anything substance that kills bacteria. Okay, that's what bactericidal is. Please don't mistaken bactericidal with bacteriostatic. Don't mistaken them. Bacteriostatic inhibits their growth and multiplication. Bactericidal kills them. Okay, so I hope you have cleared the doubts here. Let's go to the next question. It says I'm sorry you might not be seeing the questions clearly, but I'm seeing them clearly here, so I'll be telling you what they are saying. So it says that psychoanalytic theory in the area of child psychology was propounded by who? Who do you think propounded it? Okay, if you don't know the answer to this, what is the most common name, okay, in mental health? Sigmund Freud, of course. So that's the answer. I don't think I need to explain anything here. Sigmund Freud. You see, Sigmund Freud is actually the founder of psychoanalysis, and his theories on psychosexual development are actually foundational to the psychoanalytic approach to child psychology. You see, Pavlov is actually known for classical conditioning. Am I wrong? No. What about Jean Piaget? Jean Piaget is actually known for his theory on, is it cognitive development? Yes, I'm very sure. What about Alfred Adler? Is an individual psychologist who branched off from Freud. So he was against Freud, anti-Freud in other words. So question 23, it says the following are components of psychology except. What's the answer? We have stratification, emotion, motivation, and personality. So what is actually asking us, like, which of these are not components of psychology? So the answer is stratification. Why is it stratification? What is stratification actually? Stratification is a sociological term referring to the arrangement of groups in a hierarchy. So the other options are actually key concepts within psychology. So they are wrong. All right. Let's go to the next one. It says one of the following is not a coping mechanism. One of the following is not a coping mechanism. So A is problem focused, B cognitive focused, emotion focused, and solution focused. What do you think is the answer? So the answer is solution focused coping mechanism. All right. So actually, while solution focus is a type of therapy, type of therapy actually, it is not a standard recognized category of coping mechanism in psychological theory. The main categories are problem focused and emotion focused. So actually, for questions like this, if you do not read or have practiced them before, you actually fail. These are questions that you just have to read to know the answers. There's less chance of guessing them correctly. So please, you need to read your books. If you have not been reading, please get started soon or follow up my questions as we practice along. So number 25. The term that describes a therapeutic process based on the belief that behavioral disorders are related to unresolved anxiety, providing childhood experiences that are repressed into the unconscious, is known as. A very long question. What do you think number 25 is? What's the answer? Look at the options clearly. It says social analysis, psychoanalysis, and physioanalysis, repressed analysis. What is the answer? The answer is psychoanalysis. All right. So the reason why it's correct is because psychoanalysis is actually a therapeutic approach that focuses on bringing repressed unconscious thoughts and feelings into the conscious awareness to resolve inner conflicts. Okay. So why are the other options wrong? A is wrong because social analysis, is a behavioral therapy focused on changing learned behaviors. B is actually wrong because it is a cognitive therapy which focuses on changing distorted thinking patterns. And D, repressed analysis, is also wrong because it focuses on personal growth and self-actualization. So the answer is psychoanalysis because it is a therapeutic approach which focuses on bringing repressed unconscious thoughts and feelings into conscious awareness in order to resolve inner conflicts. So if you haven't read your mental health very well, please go back to it. The next question, the following are characteristics of personality disorders except. Take a good look at the options and tell me your answer. Without much ado, the answer is result in dementia. This is the answer. The following are characteristics of personality disorders. So all of the following are personality disorders, but it results in dementia? Nope, it is not a characteristic of personality disorder, and I'll tell you why. So personality disorders are actually chronic patterns of behavior, and they are not neurodegenerative. Okay, they do not cause dementia. All right. So dementia is a neuronal disease. If you know anatomy very well in your physiology, you know that dementia is a neuronal disease. Okay, it's not due to a personality stuff like that. So that's why that is the answer. Okay, let's go to number 27. Okay, or should I just tell you why A, B, and C are not correct? Okay, let me just tell you. So it says that relatively persistent traits. We know that personality disorders often lead to social isolation, right? Okay, so it says B says spontaneous exacerbation and remissions. We know also that they are chronic and resistant to treatment, especially this spontaneous exacerbation and remission. They are chronic, they are resistant to treatment, of course. All right. Also, C resistant to treatment here, as I said in B. So this is the answer. Let's go to 27. It says hyperaldosteronism occurs due to damage to what? Adrenal gland. Of course, I don't even need to see the option here. I know the answer. Adrenal gland. That's the answer. Okay, should we go on, or let me just explain? You see, aldosterone is a hormone, right, which is produced by the adrenal cortex of the adrenal gland. So hyperaldosteronism is a condition caused by the overproduction of this hormone, which is stemming from the issue with the adrenal gland itself. So as for the other options, we know that they are not even related. For example, you see the pituitary gland, thyroid gland, and the pancreas produce different hormones. So adrenal gland is the actual answer. Okay, so the test that's 28, the test that best evaluate the ability of the kidneys to regulate fluid is what? What do you think is the answer? It says BUN, urine specific gravity, creatinine, and urinary protein test. What is the answer for this? All right, let's start with A, BUN. Is that the answer? Nope. BUN actually measures waste products. What about B? Urine specific gravity. Yeah, I think B should be the answer. Or let me just see creatinine. Let me see the rest. C, D. Nope. Urine specific gravity should be the answer. The reason why this is the answer is because urine specific gravity measures the concentration of urine, which is a direct reflection of the kidney's ability to concentrate or dilute urine, and therefore regulates the body's fluid balance. So creatinine clearance actually measures filtration rates, and serum albumin is a measure of protein in the blood. You see? So let's go to the next. It says the increase in the percentage of eosinophils leads to what? Who can tell me quickly without thinking twice? What is the answer? Allergic reaction. Eosinophils are associated with allergic reaction. That's it, clear, simple, just you don't even need to think about this. Actually, eosinophils are a type of white blood cells that play a role in allergic reaction and fighting particular infection. All right, so an increase in their number is called what? Eosinophilia. So it's a key indicator of these conditions. Okay, so let's go on, or let me just tell you why A is actually wrong. So excitement. Or no, rather, let me just tell you the function of the other white blood cells. Okay, we know that in neutrophils, an increase in neutrophils suggests what? Bacterial infection, right? What about increase in lymphocytes? What they suggest? They suggest viral infection. What about increase in basophils? Quickly, they are actually associated with allergic reaction also, but eosinophils are a primary indicator. All right. Assuming basophil was replaced with eosinophil, B should have still been the answer. Okay, so let's go with 30. The following are function of plasma proteins except what? Okay, can you give me an answer quickly? Number 30. Transportation, yes, we know that plasma proteins aid in transport of hormones and so forth. What are buffering effect? Yes, plasma acts as buffers. Plasma proteins, sorry, they act as buffers. Osmotic pressure, of course, now osmotic pressure, albumin is responsible for maintaining the osmotic pressure, oncotic pressure. So antibiotic effect is the wrong answer. That's the answer actually. So let's go to the next. It says the ABC of cardiopulmonary resuscitation, CPR mean what? Who knows it? Is it artificial breathing compression? Nope. It's airway breathing and circulation. That's the answer. I don't need to explain it why. All right. So what about 32? The state of being free from microorganisms is called what? What is it called? Quickly, asepsis. Thank you very much. That's the answer. Asepsis is just the absence of disease-causing microorganisms. So the absence of microorganisms or a state of being free from microorganisms is called asepsis. Okay. Should we talk about the rest? No. Let's just skip it. I think you should know what antiseptic means now. Aseptic technique, sterilization. Come on, you're a nurse. You should know all these things. I should not even explain it. So 33. The position in which the patient lies on his back with 2 or 3 pillows under his head is known as what? Nurses, what is the answer? The answer is semi-recumbent position. D. Very sweet question. I love this kind of question. So a semi-recumbent position is just basically a position where the patient lies on their back with the head and upper body slightly elevated, which is what is being described. So the other options are wrong. Okay. Other options are wrong. So what does dorsal position actually mean, Seth? So it just means when you're lying flat on your back. What about prone? It's lying on the stomach. What about Fowler's position? Do you know what Fowler's position is? So it's where the torso is actually elevated to a more upright position. All right, so just check out the images on Google and you will find out different kind of position. But for this question, this is the answer. So 34. We'll go when we reach 50, we'll take a break and continue. All right, so let's go to 34. The following are adaptive processes of the cell except what? Is it hypertrophy, hyperplasia, atrophy, and lysis? What's the answer? Adaptive processes of the cell. Which of them is not? The answer is lysis. So lysis is basically the bursting or the destruction of cell, which is a form of cell injury, and it is not an adaptive process. Okay, if you put a cell in a hypertonic solution, what happens? Hypotonic, what happens? The cell will absorb more water and burst, right? So is that like an adaptive process? No, it can't be an adaptive process. So what is hypertrophy? Increase in size. What is hyperplasia? Increase in number. What is atrophy? Decrease in cell size. So lysis is the answer. 35, number 35. Contractures often occur after bone healing due to what? Who can tell me? Secondary infection? Nope, it can't be the answer. What about excess fibrous tissue formation? That smells like an answer. Lack of adequate blood supply, weakness in connective tissue. B is the answer. B is the answer. So contractures often occur after bone healing due to excess fibrous tissue formation. All right. So severe burns actually lead to formation of significant amount of scar. All right, and this scar is known as a fibrous tissue. Okay, which occurs during healing. So this tissue is less elastic and can shrink, leading to contractures, and these contractures limits joint movements. All right, so the other options are not the primary cause of post-burn contractures, or they rarely limit movement safe. Okay, so let's go to the next question. I'm already getting tired, but let's keep moving. So with number 36, which of these surgical procedures involve removal of a body organ? Mammoplasty, colostomy, cholecystectomy, and herniorrhaphy. Number 36, the answer is cholecystectomy. What does it mean? It's actually, let's dissect the word. Anytime you see ectomy in a word, all right, it means surgical removal. And cholecyst means gallbladder. So surgical removal of the gallbladder. That's the answer. Simple and short. So what is mammoplasty? It's just surgical reshaping. Reshaping of the breast. Surgical reshaping, not removal. Colostomy is just simply the creation of a surgical opening. What is herniorrhaphy? Herniorrhaphy is the surgical repair of hernia. Don't be confused. If you see a question like this, don't forget I told you about it. Number 37. It says the third, fourth, and sixth cranial nerves control the. What does it control? Is it pupil size, visual field, extraocular movement, or intraocular movements? So I'm waiting for your answer. You need a very good understanding of anatomy to answer this. So the answer is C, extraocular movements. The answer is C. All right. So we know that these three cranial nerves, the third, fourth, and sixth, what are they? Third is oculomotor, fourth is trochlear, and adult sense is the sixth cranial nerve. So they are responsible for controlling muscles that move the eye. That's what extraocular mean. Okay. For the other options, pupil size, it is actually controlled by oculomotor nerve, but this is only part of the function. Visual field is primarily controlled by optic nerve. Intraocular movement, however, it refers to the structures inside the eye. Okay, so the purpose of tonometry is to determine what? You can tell me quickly, is intraocular pressure. A is the answer. We don't even need to go too far. So what is tonometry? That's what you need to know. When you see a question like this, you need to understand what the question is inferring to, the specific term. So if you don't know what tonometry is, how will you be able to answer this question? Okay, so tonometry, are you listening to me? Tonometry is a diagnostic test that specifically measures the pressure inside the eye. Okay, intraocular pressure, and this is a key indication for glaucoma. All right, so that's it for that. Number 38. Can we move to the next one? Number 39. The characteristic of serous otitis media include the following. So only one is correct here. What is the correct answer? A. Is A the correct answer? Retracted eardrum? Yes. What about perforated eardrum? Nope. Purulent drainage? Nope. Dilation of eustachian tube? Nope. So for number 39, A is the correct answer. So the reason why it's correct is because, serous otitis media, right, is a condition where fluid builds up in the middle ear. So this often causes the eardrum to be retracted due to the negative pressure in the middle ear. So there will be negative pressure, the ear will be retracted, and that's it. Or rather, the eardrum will be retracted. So the other options are not a typical characteristics of serous otitis media. So if you haven't understood it yet, please go and read otitis media, just really briefly, and you understand why A is actually the correct answer. So number 40, when a hernia can be pushed back into the abdominal cavity, it is called what? I've seen the answer already. What is your answer? I'm giving you a few minutes to answer that. Well, the answer is reducible, and I'll tell you why. So, a reducible hernia is one where the protruding tissue, the tissue that protrudes, can be manually pushed back into the abdominal cavity. All right, so that's it. The options are very, very wrong. Okay, you see, an obstructed hernia is one where the bowel is blocked. All right. What about an irreducible hernia? Is one that cannot be pushed back in. All right. What about strangulated hernia? In fact, strangulated hernia is very, 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 very dangerous. It is an emergency, all right, because in this case the blood supply is even cut off totally. So the answer is irreducible. So let's go to the next 41. In acute pancreatitis, the most specific pathophysiology is what? Acute pancreatitis. The specific pathophysiology is autodigestion now. Yeah, come on. That's it. Why even pondering on the question? Autodigestion is the answer. And the reason is because acute pancreatitis is primarily caused by premature activation of the digestive enzymes within the pancreas itself. Okay, so these enzymes then begin to auto-digest the pancreas, causing inflammation and damage. Okay, so the other options are not even related, okay, to the pathophysiological mechanism. So A is the answer. The clinical manifestation of acute pyelonephritis include. What's pyelonephritis? Do you know what it is? All right, first of all, let's look at the options. It says hematuria and hemoptysis. What's hemoptysis? It's not vomiting of blood. What about elevated blood pressure, albuminuria, and edema, vomiting, headache, and malaise? So what are the clinical manifestations of this disease? The answer is D, not A, B, or C, and I'll tell you why. So you see, acute pyelonephritis is a very serious kidney infection. All right, nephritis. If you see nephritis in anything, okay, nephritis means kidney disease. Nephritis, kidney disease. All right, or infection rather, not disease, infection, kidney infection. Okay, infection of the kidneys. That's what nephritis means, and this is actually the symptoms or clinical manifestations. So the other symptoms include fever, chills, pain. General symptoms also include vomiting, headache, and malaise. All right, so the other options in the list are not primary or defining clinical manifestations. Let's move forward. The blood vessels that have the primary function of transporting nutrients and metabolites are known as What is the answer? Quickly. Capillaries. They are responsible for transporting nutrients and metabolites. Okay, please. They are these are capillaries are the answers. Please, there's no need to even explain it. Okay, you see, capillaries are actually the smallest and the most numerous blood vessels. So, and they have very thin walls, and because they have thin walls, they are responsible for the exchange of oxygen, number one, nutrients, number two, and waste products between the blood and the body cells. All right, I think this is a very convincing explanation. All right, so the other options are wrong. In fact, C, B, C, and D, they are responsible for transporting oxygen and CO2. All right, to the lungs and from the lungs. So number 44, the most common problem associated with immune suppressive therapy is what? Please, what is it? Can you tell me? Look at the answer question very well. The most common problem associated with immune suppressive therapy. That means these are treatments that suppress your immune system. And if you are given any treatment that suppress your immune system, like chemotherapy, for example, what do you think will happen? You'll be predisposed to infection. So this is the answer. All right, this is the answer. We don't need to waste time here. Okay, this is the answer. So number 45, are characteristics of the pancreas except, let's see, it weighs 60 to 90 grams. Yes, that's the weight. It has both endocrine and endocrine function. Yes, it does. It contains cells called islet of Langerhans. Yeah, pancreatic islet of Langerhans. The alpha cells secrete insulin. I don't think this is the answer. I think it's the beta cells, if I'm not mistaken. So D is the wrong answer. We have chosen it. Should we move on or we have to explain it? Right, so the beta cells, as I said, is what secretes insulin, while alpha cells secrete what? Who can tell me? Glucagon. So in the next question, acromegaly, the following features will be present except. Let's check it out. Okay, look at the options clearly. Which do you think is the answer? So all of them are present except abdominal enlargements. You never see someone with acromegaly with an enlarged abdomen. I don't think I've ever seen that. And I don't think you will ever see it too. Okay? So let's move forward. Or rather, what's acromegaly in fact? It is a condition causing overproduction of growth hormone. All right, so this leads to enlargement of feet. You see that their feet are very large, their hands are large, they have huge facial features, but abdominal enlargement is not typical of it. Okay, so let's go to the next one. Which of the following substances are necessary for converting prothrombin to prothrombin? All right, this calls your knowledge of blood. If you know blood very well or blood coagulation, I think you should know the answer to this. So what do you think is the answer? Simple and short, thromboplastin and calcium. These are the answers. This is the answer. Thromboplastin and calcium. What else? Let's go to the next question. 48. A nomocytic nomochromic anemia may be caused by what? Nomocytic nomochromic anemia may be caused by chronic infection, bone marrow suppression, folic acid deficiency, and vitamin B12 deficiency. What do you think is the answer? So the answer is bone marrow suppression. I'll tell you why. All right, bone marrow suppression. So what is nomocytic nomochromic? What does it even mean? So it means that the red blood cells are normal in size. That's what nomocytic means. Nomochromic means they have a normal color, but there are a lot of it, but they are not enough. They are not enough of them. All right. So this is typically caused by a problem with bone marrow's ability to produce red blood cells. So if the bone marrow is suppressed, if its function is depressed, we see that we have this condition. Okay, we have this condition, anemia, nomocytic. All right, of course I said nomocytic means a normal size, nomochromic normal color, but anemia means decrease in size. Okay, it's because of bone marrow suppression. So iron deficiency, what does iron deficiency anemia causes? Please let me ask you, quickly answer me. Iron deficiency anemia actually is its characteristic is actually microcytic, number one, and I think hypochromic anemia. Yeah. So sickle cell anemia, of course, you know it is a hereditary condition with abnormally shaped cells, right? What about the lack of intrinsic factor? What does it cause? Quickly, it causes pernicious anemia, okay, which is macrocytic, which is large red blood cell. Let's move forward. The primary emphasis in the dietary management of congestive heart failure is what? The primary emphasis in the dietary management of congestive heart failure. What do you think is the answer? Of course, if you see a patient with congestive heart failure, I think the priority here is to reduce sodium intake. Yes, that reduced dietary sodium is very important, all right, because the heart pumping action is actually weak here, and therefore there's fluid retention. So if you reduce dietary sodium, it helps the body to excrete excess fluid and reduce the workload of the heart. Okay, you know that if you take too much salt, what happens? There's in salt we have sodium, and of course the kidney in the distal convoluted tubules. What happens is that there's absorption, not in the DCT, actually in the collecting duct, the absorption of water, right? And the absorption of water what increases blood pressure, increases fluid volume, and also increases the workload of the heart. So that's why you have to reduce the dietary sodium, or rather reduce salt intake entirely. So the term that describes the body ability to maintain a normal state is what? Homeostasis. I don't want to even explain this. I believe you guys are both this, like you guys are both the understanding here. All right. So I think we'll take a break here and then we'll come back for part 2. Thank you very much. And we'll see you later. Goodbye.